was going to say, Jackie, I don't hear anything. All right. Thank you, Jackie, so much. And thank you, everybody, for coming today. And so to get started, we are going to talk about ways to discover your path on how to prevent diabetes. All right. We're going to go over the possibility that you may be on the road to getting diabetes. We'll talk about some of the risk factors today, including family history. Other things that we'll talk about are your blood sugar levels or your A1C, some of the results that can confirm that you have prediabetes. And also, more importantly, we'll talk about how to reduce your risk through some of the lifestyle changes. So we'll talk about exercise and healthy eating as well. All right, so the purpose of this class, we're going to talk about learning about preventing type 2 diabetes, what prediabetes is, learning how to take control of your health. In addition, we will help you explore programs that are eligible and that can help to support you, and also choosing your next step. What would you like to do to help prevent that diagnosis of diabetes? All right, and the questions that we will cover today: what is prediabetes and why is it so important? Why is diabetes a concern? What can you do to prevent type 2 diabetes? What changes are you ready to make? What options are available? And what is your next step in prevention? It is important to understand what prediabetes is so that you can take the steps to help in preventing developing type 2 diabetes. So what exactly is prediabetes? Prediabetes is a condition where your blood sugar or your glucose levels are high, but they are not quite high enough to be diagnosed with diabetes. And to explain this, we'll kind of go over what happens when you eat, what happens in the body that can cause the blood sugars to go up. All right, so this slide shows how food is broken down in your body. So the first one is if you eat foods with carbohydrate, especially things like grains, fruit, milks, and sweets, all of those carbohydrate foods start to break down into sugar, also known as glucose. And once that happens, the sugar can enter into the bloodstream. Once that sugar is into the bloodstream, it signals your pancreas to start making insulin. And insulin is represented here by those little keys. And those keys can be used to unlock your cells. The insulin helps the sugar go into your cells. So the key is thought of unlocking it, letting the sugar in. The cells can use that sugar or glucose for energy, and a lot of other processes as well. So this is what normally happens without diabetes or without prediabetes. And so to explain what happens if you have prediabetes or diabetes, something called insulin resistance. So the same thing happens. You eat foods, especially those foods with carbohydrate, they break down into sugar in your body, and the sugar goes into the bloodstream. And then the pancreas makes the keys or the insulin to help that sugar enter the blood. But when it's not entering the cells like it should, so the keys really aren't fitting into the locks of the cells, the sugar builds up higher and higher into the bloodstream. And when it goes higher in the blood, your body starts to actually make more insulin to try to bring those blood sugars down. So the cycle continues on and on, especially when you eat. The blood sugars go up and your body produces more and more insulin. One of the problems is with insulin resistance is it does make it very difficult to lose weight. So we'll talk about some ways to overcome that in just a minute. Also, if you've noticed, anyone has noticed if they're hungry after eating a meal, what is supposed to happen is shown before. The sugar is supposed to enter the cells to give you energy. But when the sugar is not entering the cells, your cells may feel like you're starving. So you may feel like you're hungry all the time. And you may also feel tired all the time and fatigued because the sugar is not getting into your cells to give you energy. All right, so if you're wondering how this is diagnosed, there's a diagnosis for both prediabetes and diabetes as well. The main thing that is done is a blood test called the hemoglobin A1C. So the hemoglobin A1C measures your blood sugars over a 3-month period. And with the hemoglobin A1C, you do not have to be fasting to get this lab done. It's a blood draw, and it checks your red blood cells or your hemoglobin and how much sugar has really been sticking to those over the last 3 months, because your red blood cells turn over every 3 months. So it doesn't matter what you ate the previous day. A lot of individuals think, well, I had pancakes for breakfast, or I had a pasta dinner the night before, all that carbohydrate, so my A1C is going to be high. But really, it doesn't matter what you had that morning or the night before. It is more an average of those 3 months for your blood sugars. And here we'll look at the levels of what indicates diabetes versus prediabetes in the non-diabetes range. So for the first one here with diabetes, 6.5 or above is considered to be in the diabetes range. With prediabetes, 5.7 to 6.4. And then the normal or the non-diabetes range is 5.6 or less. So if you go to your doctor and you do get a hemoglobin A1C, you can use this guide for references into what level that you may be in. You can also, as far as the fasting blood sugar level, that can diagnose diabetes or prediabetes as well. And as you can see, the 126 or above is in the diabetes range. With prediabetes, it's between 100 to 125. And then the non-diabetes range is at 99 or below. There's another test too that you may be asked to do. It's commonly done in pregnancy. It's a glucose tolerance test, where they have you drink a really sugary, syrupy drink, and then they check your blood sugars about 2 hours after to see how high your numbers go. If it's less than 140, it's considered in the normal or non-diabetes range. But if it's 140 or above, it is considered in the prediabetes, possibly the diabetes range, depending on how high it goes. Not as common though for diagnosing. Usually those lab values there would be used. All right, so why is it important to be concerned about having prediabetes? One of the main concerns is that without making any lifestyle changes, that the prediabetes will develop into diabetes within the next 5 to 10 years. If you have a 50% increased risk of developing diabetes if you have prediabetes. And sometimes that may even happen earlier than the 5 to 10 years. It may be within the next year. So it is important that if you do have prediabetes, to make these lifestyle changes to help prevent type 2 diabetes. And what can happen over time? So if the prediabetes were to develop into diabetes and you develop high blood sugars, if the high blood sugars stay high for long periods of time, they can cause things such as heart disease, stroke. The high blood sugars can affect your kidneys. It can cause sexual problems, including erectile dysfunction. It can affect your eyes, cause blindness, loss of sensation of nerve endings with neuropathy. It can affect your brain. It can lead to dementia. Foot and leg problems such as amputation could occur. Stomach and intestinal problems can happen. And then also, because the sugar can get everywhere, affect all your body systems, including your saliva and your gums. It can affect your teeth, your skin, and your gums as well. So high blood sugars, again, over time, can really cause a lot of damage to all different areas in your body. So it is important to try to take those steps ahead of time to prevent type 2 diabetes from developing. And so one of the problems with prediabetes is that there's not a lot of symptoms that you're going to have with prediabetes. So it's hard to tell really if you do have prediabetes without going to the doctor and getting your blood work done. With diabetes, so if the blood sugars were to reach a certain level, you may experience excessive thirst and urination. That's one of the most common, is that your body's trying to get rid of that excess sugar. So it's making you drink more, and it's also making you urinate more frequently. Excessive hunger, again, if your cells feel like they're starving, that could happen as well. Fatigue, your body may be lacking energy because the sugar's sticking in your blood, not going into your cells where it should be used for energy. Blurred vision could occur, slow healing of sores or frequent infections. If there's a lot of sugar in your blood, that creates an environment for slow healing and for infections to occur as well. Tingling hands and feet is another sign of diabetes. And then red, swollen, or tender gums could be a sign as well. So if you are experiencing these symptoms, definitely I would recommend asking your doctor to get checked for diabetes. And as far as prediabetes facts right now, this is the most recent information from the CDC. And as many as 96 million American adults have prediabetes. That is huge. That's 1 in 3 adults have prediabetes, but unfortunately, more than 8 in 10 adults don't even realize that they have it. So without having a lot of symptoms, a lot of people are walking around right now not even knowing that they have prediabetes, and some with even diabetes as well. So again, we can talk about in just a minute what you can do to help prevent these things from developing, but prediabetes can increase your risk for type 2 diabetes, for heart disease, and for stroke as well. And the main thing is, if you do have prediabetes, we'll focus on healthy eating and being active to help cut your risk of developing type 2 diabetes in half. All right, so we're going to look at some ways that you can help prevent diabetes from developing. And there's certain factors that you can change in your life. There's certain factors that are not changeable in your life. So first we'll go over the unchangeable factors, then we'll look at the ones that you have some control over. So the first one, risk factors that increase your risk for prediabetes, is being over age 45. Family history, so things that you can't change, family history, genetics, if you've had a parent or siblings with diabetes, that increases your risk. Certain races increase risk, African American, Pacific Islander, Hispanic American, or Asian American If you have a history of diabetes during pregnancy, also known as gestational diabetes, that can increase your risk as well. Polycystic ovarian syndrome, that causes insulin resistance, and that can increase your risk for prediabetes and diabetes as well there. So these are things that you cannot change. But the good thing is that you do have control over some things, or the ability to make changes to help certain things. The first one is weight. So if your BMI is 25 or greater, you are at increased risk of developing diabetes or prediabetes. So by losing weight, that can help to decrease your risk. If your cholesterol level, the HDL is low, so the HDL is the good cholesterol. We want that to be at least more than 40, more than 50 for women is even better. But if your LDL or HDL is low, that can increase your risk. And then if the triglycerides are high, being more than 150, that increases your risk as well. If your blood pressure is greater than 130 over 85 or higher, that increases your risk. The physical activity level, so if you're very physically inactive, that increases your risk for developing diabetes. Diet, so eating a healthy diet, we'll go over some things today of what a healthy diet may look like. And then also smoking can increase your risk as well. Smoking causes insulin resistance, so your insulin doesn't work as good in your body, and that causes the blood sugars to go up. So out of all of these things, the good news is that prediabetes is reversible. So once you are diagnosed with diabetes, there is a possibility you can get into a state of what's called diabetes remission. It is very difficult, but that is something that can happen. But right now, if you've been diagnosed with prediabetes or think you may have prediabetes is completely reversible. So you really want to start taking action now to make some changes to help reduce that risk for anything developing into type 2 diabetes. All right, so the things we're going to focus on that you may have some control over in changing, 6 steps to good health. The first one is to lose weight if needed. Again, if your BMI is 25 or greater, it is recommended that weight loss can help to reduce the insulin resistance. Being more active every day. So the recommendations for prediabetes is to be active at least 30 minutes, 5 days a week. And we'll show you how to get some of that physical activity in. If you can do more, great, but at least the minimum is to try to get in that 30 minutes, 5 days a week. Making wise food and drink choices. We'll go over some of the different foods and drinks and what are some good choices to make. Stop smoking. That'll help to reduce that insulin resistance. Taking medication as prescribed. So if you do have high blood pressure or high cholesterol levels, you want to make sure that you're taking that medication, because by decreasing the blood pressure or those triglycerides that we talked about, that can help to reduce your risk for developing diabetes as well. And of course, visiting your doctor regularly. This may have been tough over the past few years. Not as many people were coming in to doctor's appointments. The last 2 years have not been as kind to us, I guess. It's been very difficult for everybody and very stressful. Stress can raise the blood sugars too. So now, hopefully things are starting to get back to somewhat how they were a few years ago, and then making some changes now to help to prevent that diabetes from developing again. So first we'll talk about the weight loss. And a lot of people think that you need to lose a lot of weight to help prevent diabetes or to get healthy, but really it's been shown in several studies that a modest weight loss, so even 5 to 7% of your current body weight, as far as losing the 5 to 7%, would help to reduce your risk as far as developing diabetes. And for an example, if someone were to weigh 200 pounds, that is going to reduce their risk by losing 10 to 14 pounds. So it's not a lot of weight loss, You can start out slow. Your goals may be bigger or smaller than that, but just starting out at that 5 to 7% and then kind of going from there. But it has been shown to really reduce the risk for developing type 2 diabetes. And then one of the other things that we're going to talk about next is physical activity. And again, about 30 minutes, 5 days a week at least. But I am going to turn it over to Rebecca, who is going to talk about the exercise and the physical activity.
Wonderful. Thank you, Sarah. So getting started, right, with activity, let me first start by saying small changes make a big difference. And getting started is so easy, simply by making normal tasks a bit harder or perhaps a bit longer in time. If you take a look at your day to see how you can make some small changes, it's easy to do. Like, for instance, choosing a parking spot that's farther away from the store gets you extra steps. In addition to that, once you're in the store, maybe do a loop around the store, a second loop. Take the stairs. That's always a great choice. It improves heart health. It increases muscle strength, in addition to building endurance, which is very important as we're building an exercise routine. Use a bathroom further away from where you are, whether that's at home or in the office. Perhaps use it on a different floor. Maybe you could even incorporate some stairs in there. Putting the laundry away, that's a good one. Leave the laundry basket either in the hallway or at the foot of the stairs and go back and forth to put things away. Bottom line is, every little extra effort adds up and equals more for activity throughout your day. So let's go to the next screen, please.
Sorry, I got stuck a little.
Okay, wonderful. Getting started and sticking with it, right? That's important. So when we start, first of all, check with your doctor to make sure that an exercise program, before you start an exercise program, make sure you have the thumbs up on that. And when we start, we want to start slow. We're only talking about beginning with 5 to 10 minutes of activity 3 times a week. We have a saying in one of our programs here in Livestrong is low, slow allows you to grow. So when you start a program out slow and low, it gives your body time to acclimate to the movement and to the activity and allows you to grow. And then you can add 2 to 3 minutes each week to build up to that goal of 30 minutes. And then you can add additional days until you are at your 30 minutes per day and active for 5 days a week. Then we go into discovering what activities are going to fit you best. Explore a variety of activities to see what speaks to you. Because I can tell you, if it is a chore, you won't do it. Remember, this is for you, so you want to find things that you enjoy. So look for activities that are fun, such as dance classes, playing pickleball, exploring the farmer's market on a Saturday, or doing some additional yard work. Also, exercise is always fun with a buddy. So if you can find a buddy to do that with, that's often a great tool. Walking with a coworker at lunch, walking your dog, walking with your partner after dinner, or my favorite, walk and talk. We have so many hands-free options of talking on our cell phones. So taking that conversation out into nature. It also helps to speed up your workout. You know, time flies when you're talking and having a good time. Next is to make use of that equipment at home. You know, we all joke about the clothes that we have hanging on our treadmills and ellipticals, stationary bikes at home. Start making use of that equipment, especially in inclement weather. It helps to get that workout in so you don't miss it. And there are so many videos via YouTube, virtual platforms that are available to help you make it a great workout at home. You can also start incorporating weights and resistance bands that you have lying around to really take your workout up a notch. And if you're just starting, don't get overwhelmed. Chair exercises are a great way to begin. And there are so many modifications to suit any fitness level, in addition to progressing. And on that note, if I can just add, preparation is key. Make sure that all your exercise equipment at home is organized and accessible so that when you're ready to use them, you can get started. Because if you're spending time looking for a resistance band that you know you had somewhere, or you're waiting for your iPad to charge so you can listen or watch something while you work out, these things tend to derail us and takes away from the time that we can spend working out. Next is to consider joining a gym, health club, or senior centers. These are your one-stop shops. Not only do you have access to wellness centers, weight rooms, but also a wide variety of group exercise classes, not to mention pool and aquatic classes. That brings in a sense of social and community and a great sense of support there. Plus, you're surrounded by fitness professionals that are there to support you as well. And I highly recommend working with a personal trainer. That's always a great addition to your plan. Lastly, is to track your progress. Fitness trackers and apps are a great way to track your activity, and knowing how many steps and minutes you've done throughout the day helps to maintain that level of activity. And it also gives you a nice metric to look at to know when you can progress. Journaling is also a great way. I personally like to do both. This gives you a way also to celebrate your milestone victories in reaching various activity goals. And celebration and appreciation is very important. So let's go on to the next screen. Thank you. So physical activity benefits. So we know, as Sarah's taken us through, how our body responds to higher blood sugar levels and why it's important to keep them down. Daily physical activity lowers that blood sugar levels. It also improves your body's ability to use sugar by decreasing insulin resistance. And there's a few ways in which exercise does lower that. So when insulin sensitivity is increased, your muscle cells are better able to use the available insulin to take up the glucose during and after activity. And also when your muscles contract during activity, your cells are able to take up glucose and use it for energy, whether insulin is available or not. Now, I'd like to also point out that it's important for you to check your blood sugar before and after workouts to see how your body responds to activities. Weight loss is a great benefit of it as well. For every 1 pound of weight loss, that actually takes 4 pounds of pressure off your knees. That's a big deal. And it will help you to move better. It decreases stress. This is a big one. Stress management is key when managing blood glucose levels. Your body makes stress hormones when under stress. These hormones can affect blood sugar. So less stress equals lower blood sugar. And I think the most important one is that it improves your mood. This is a real big one. So during exercise, your body releases chemicals, endorphins, greatly improve your mood and have been shown to have positive effects on depression, anxiety, and stress. And let's just face it, when you feel better, you want to do more, and that's a good thing. And let's go to that next screen. Oops. Okay, so there are many different boundaries when we approach exercise, and one of which is, it's just too hard. This is where the low, slow, so you can grow motto comes in. Think about 5 to 10 minutes per day. Just try to implement that into your day. If you don't have a set 10 minutes, break it up. Do 2 minutes here, 2 minutes there, and you will gradually build up to 30 minutes in no time. Next one is the results take too long. So some benefits start right away, even if they don't seem obvious to you. So you want to just, again, take it one day at a time, work through it, because in the long run, everything is going to benefit you, from blood sugar levels to feeling better, all the way down to weight loss. It's just not fun. We did cover this. If it's not fun, you're not going to do it. So look for things that speak to you. Again, try a dance class, or just dancing around your house. Incorporate more yard work, get a friend to, go on some long hikes with, whatever. Just try something else until you find something that really speaks to you. And it costs too much. The cost of gym memberships and fitness centers can add up. However, there are so many ways that don't cost anything to help you get moving. Walking during lunch or after dinner, dancing to your favorite tunes at home, working out online, plenty of videos, the whole 9 yards. I know in our association, we are currently running a challenge called the Y170. It is not only available to our members, but community-wide. All you have to do is join our app, log your minutes, and you can win free stuff, and you have a built-in community for support. It's hard to find the time. Again, this goes back to it being too hard too. Finding ways to fit in exercise here and there. Set a timer on your watch for every 2 minutes to get up, every 2 hours to get up and walk, say 3 minutes. Everything adds up. So finding these different ways of parking further in the parking lot, as I mentioned before, taking the stairs, taking longer to do some tasks at home, everything counts as far as the activities. So you can fit it in here and there. Don't think about you have to put a large amount of time aside. The next one, I'm too old. No, you're not. It's never too old to become more active. As I mentioned before, there are chair exercise options that you can do right in your home that are easy to do. In addition to, as mentioned here, pool walking, which is wonderful, easy on your joints, but lots of low impact activities out there for you to take advantage of. The last one, I'm too out of shape. Low and slow, you have to start somewhere. That first step is going to be crucial. Once you start, you're home free, right? So it's just about starting out and doing what you can do and celebrating what you can do each step. So again, there are many things, as mentioned here, it's just walking to your mailbox, simple things like that, or running errands and parking further away from the door, as we've said many times. These things can add up. In addition to discuss other ideas with your healthcare provider. I'm sure that they have plenty of options that they can provide as well.
All right. So now we'll talk about finding a healthful eating pattern. We discussed the exercise, and now we'll talk about what you can do as far as healthy eating. And when you find a healthy eating or healthful eating pattern, you want something that's really sustainable. So not something that you can follow short term or a fad diet that you can do for maybe a couple weeks or a couple months, but really trying to find something that's sustainable that you can follow the rest of your life. We'll talk about choosing carbohydrates wisely to help the blood sugar levels. And then also about beverages. So anything in liquid form as far as carbohydrate goes. So sugar is a carbohydrate, but anything that's in a liquid form can really break down quickly, absorb in our bodies really fast, and then spike the blood sugar levels. Once the blood sugar levels spike, your body has to create insulin to bring it down. And if that's constantly happening, again, that can lead to insulin resistance. So you do want to be careful with what you're drinking. Water, of course, is the best. You want to look for drinks that have 10 calories or less. But again, water is the best choice for beverages. If you want to do unsweetened tea or unsweetened coffee, something like that could be good too. But again, sticking with water for the most part. Trying to include 2 to 4 servings of fruits and vegetables, or 2 to 4 servings of fruit and 3 to 5 servings of vegetables per day. So by increasing this, you increase your nutrients, your vitamins, and your fiber intake as well. But we'll go through some of the different carbohydrate food sources and which ones may be a better choice as far as the blood sugars go. All right, so some of the carbohydrate foods include your milk, your breads, your cereal, grains, pasta, starchy vegetables, certain snack foods, fruit, and then of course sweets. So as far as the milk category, you want to choose lower fat dairy, or yogurt is a good choice, especially the Greek yogurts, the ones that are unsweetened have a lot of protein and they're lower in sugar. So that could be a good choice. With your breads, the whole grain breads, things with more fiber are going to be better. The cereals, so whole grain cereals are going to be a better choice than some of the sweetened cereals. Cereals do tend to absorb a little bit quickly because they are processed so much. So you do want to get ones with minimal processing as well. Grains such as rice, brown rice would be a good choice. With a pasta, whole grain pasta. Starchy vegetables are listed. They have carbohydrate, but beans would be a good choice. So beans have carbohydrate, but they also have fiber. They have protein, helps them to break down slowly, which can be good for the blood sugars too. With snack foods, you want to try, of course, if you can snack on fruits and vegetables, that is great, but other types of snack foods like chips or crackers. Popcorn is a good option. It does have some fiber, and if you can make it yourself, it makes it a really good option. Fruit has carbohydrate in it, so you do want to be careful. You don't want to overdo it with fruit. It's still good. You want to eat fruit, but just try to maybe limit how much at one time. And then choosing the whole fruits versus the fruit juice. When you drink juice, all the fiber is taken out of the fruit and you're just left with the liquid form. And it's natural sugar, but again, it gets absorbed quickly and can raise the blood sugar levels. And as far as sweets go, once in a while, try to limit the amount of sweets that are in your diet because they could be high in sugar and again, high in carbohydrate, which can spike the blood sugar levels too. All right, so some of the most common healthful eating plans include the Mediterranean diet. That includes a lot of fruits, vegetables, and healthy fats. So olive oil and fish is a big part of it too, the omega-3s. Salmon could be a good choice there. So the Mediterranean way of eating can help prevent diabetes, but also can lower cholesterol levels. The DASH diet is meant for lowering blood pressure. It's dietary approaches to stop hypertension. And again, plenty of fruits and vegetables in this plan as well, and a lot of fiber. So that can help lower cholesterol and help to keep you full, but also to lower your risk for developing type 2 diabetes. There's vegetarian and vegan ways of eating, where vegetarian, no meat, vegan, no meat products whatsoever, no dairy in that as well. Low carb could be a healthful eating plan if you choose your carbohydrates or your fats wisely in that part. You want to choose the healthy fats if you're going a little bit lower carb, and then decreased calorie plans where you're cutting back on the portion sizes of foods, which overall decreases calorie intake, which can help with the weight loss and help to prevent type 2 diabetes as well. So no matter what path you choose, you do want to choose something, again, that's sustainable, that you feel that some changes that you can make long-term versus a quick fix. All right, and the next topic that we'll go over is stopping smoking. People with diabetes are 3 times more likely to die of a heart attack or stroke. So if you add in smoking, that does increase your risk by 11 times. Smoking raises your blood sugar levels. So by smoking just 1 cigarette, it reduces the body's ability to use insulin by 15%. So if you're at risk for developing diabetes and you're smoking, that can cause the insulin resistance and can cause the blood sugars to go up even more. All right, so we'll go over some of the options that you can do to help prevent diabetes. So following up with your doctor, of course, it's important for everyone with prediabetes to get that blood sugar checked at least every 6 months. Again, the A1C is that 3-month average, so it can be done every 3 months, but at least every 6 to get your weight and your blood pressure checked, to check your overall health, see how everything is going, and also to ensure that you're taking the medications as prescribed. Again, especially if you are on medication for blood pressure or cholesterol, by taking those, decreasing those levels, it can help to decrease in developing type 2 diabetes. Other programs to consider: medical nutrition therapy, weight management programs, and also diabetes prevention programs. So as far as medical nutrition therapy goes, this would be nutrition counseling It's a one-on-one session. You would meet with a registered dietitian to learn about healthy eating and meal planning. And oftentimes they will help you to develop a personal meal plan, something specific that you are able to do, and also to set up goals. It is recommended to have at least 3 sessions with the dietitian to set the goals and follow up to make sure those habits are sticking. If you're interested in that, make sure that you do ask your doctor for a referral to see a dietitian for medical nutrition therapy. There's several weight management programs available. I know that we have one at Henry Ford that includes weekly group education sessions. There's a dietitian, a nurse, exercise physiologist, behavioral health professional, includes visits for meal planning and health coaching as well. There are options to use meal replacement shakes that they have with the program, entrees and snack bars as well. There's education and support for meeting behavioral health and physical activity goals as well. And this is one of the main ones that has a lot of studies out there that have shown that the diabetes prevention program through the CDC, oftentimes the National Kidney Foundation may be involved as well, but there's a program, it's for 6 months. There's weekly classes, about 16 classes, and then the second 6 months, monthly classes. It was virtual. I'm not sure if it's going back in person at any point, but the last that I checked, it was a virtual program. So you would meet for your class online like this. And people with prediabetes can reduce the risk of developing diabetes for up to 58% through lifestyle changes taught through the diabetes prevention program. So they really go over a lot of the things that we discussed today, but a lot more detail, and then following up for a long period of time to help with that success rate. And this is just an example of what individuals do think about the diabetes prevention program. It's fun and engaging, led by a lifestyle coach. And then it helps with support with a group of people that have similar goals and challenges. Right. And then a lot of the things, again, that we discussed today, healthy eating strategies, how to set realistic and attainable goals, how to add physical activity into your life, ways to overcome challenges, and to get back on track if something were to happen and you felt you were falling off track or away from your plan. The encouragement is there, the follow-up is there to help you succeed. Other resources may include smoking cessation programs, weight loss and exercise apps. And there are several smoking cessation programs throughout hospital institutions. You could ask your doctor to referral. Many offer telephone counseling and in-person and video sessions as well. Weight loss programs and apps. So these are just a few examples, but there are several apps out there right now. There's Weight Watchers on here, MyFitnessPal. The little orange guy is Fooducate, that it rates different foods and gives you more information about different foods that are out there. And so there are several programs and apps, finding one that works for you. And then, of course, we talked about joining a health club or something like the YMCA, so that you do have the access to the equipment, but also programs to learn more information about overall health. And so, what do you want your next step to be? We do recommend contacting your insurance company. There are a lot of insurance companies right now that do have programs that are included with your insurance plan. So if you do check with that, you can contact them to see if their nutrition is covered or if any weight management programs are covered. But so they may be fully covered, maybe cover a portion, but they also are involved with gym memberships too. I know a lot of give discounts or will pay a certain amount each month for a gym membership. So contact your insurance company to see what is available to you. And to learn more, you can log on to the CDC. There is great information about prevention of diabetes and their classes too, if that's something that you were interested in. This is the link here, but at cdc.gov. And then the diabetes basics pre-diabetes, there is a quiz. If you would like to take it, you can, I'm going to go to this next. This is what it looks like. So if you wanted to see if you are at risk for developing diabetes or pre-diabetes, you do want to take this quiz. It gives you a score. Again, if you are concerned about it, please ask your doctor to get that hemoglobin A1C checked to see kind of where you're at there. And all right, so now we can open it up for questions. And okay. 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 That sounds good. No, if you're interested, I would take that pre-diabetes quiz on the CDC website. And yes, really get checked, even if you don't have symptoms, but you have some of those risk factors. The more you can do ahead of time, the more you can do as prevention can really help you out in the future. So if you can do that now versus waiting too long, it can really benefit you for sure.
If you have any questions with regard to the why, or if I can help connect you to different programs or get you more information, basically be your tour guide to get started, I would be more than happy to do so.
Thank you so much.
Thank you.